Raise your hand if you've heard of Ozempic. It's a drug known for weight loss. Health reporter Haley Hernandez is here this morning to talk about the drug's popularity and risks associated with it.
I mean, it's so popular right now. You've been living under a rock if you don't know that Ozempic can be used for weight loss now. So joining me is Dr. Mirwat Sami from Houston Oculofacial Plastic Surgery. These drugs, Dr. Sami, enormously popular. There's lots of studies out there showing that the benefits outweigh the risks for a lot of patients who can lower their cardiovascular disease risk and their metabolic risk for metabolic diseases. So what are the warnings that you want patients to know about?
I think what's really important to bring up is this recent FDA update, which mentions a gastrointestinal obstruction, gastroparesis, ileus is what we call it. I think you're so right. You know, you've got to be living under a rock because everybody's on Ozempic or one of the semaglutides, which are these awesome medications that have been so effective in weight loss management, in diabetes control, but we're hearing about all these other side effects because of this rampant use. Everyone's on it, you know, and it's been like these success stories all over social media. However, that's when we discovered Ozempic face, you know, that term that's used to describe the global facial wasting. And as an oculoplastic surgeon and a facial plastic surgeon, that's what I'm seeing. A lot of that sagging, the sunken look, that gaunt look, that aged look to people's faces that they weren't expecting. That
you get from quick, dramatic weight loss.
That is correct. So this is exactly what you'd see with even other really dramatic weight loss management techniques. So even after bariatric surgery, even after really excessive weight loss over a really short period of time with diet and exercise, you'll see this global wasting of subcutaneous fat.
But speaking of gastric bypass, it seems like this would even be a safer option to gastric bypass. Like, it seems like this is really a good solution for a lot of people who struggle with obesity.
In fact, studies have shown that, for example, one of the semaglutides, Mounjaro, has effective weight loss management similar to the same amount of weight loss that we see after bariatric surgery.
After a big major surgery.
Certainly very effective medications. The only issue is all these other side effects that we're finding out about. Remember, these medications will mimic a hormone that actually slows down gastric clearance of food. And so now the people are sitting with entire bellies full of food, feeling really bloated, and we know about these side effects, but they do have an impact on their health if it's causing other intestinal issues. There have been reports of intestinal obstruction.
So talk about that, like real slowing. We always have to fast before surgery. If somebody has food sitting in their stomach, there's some idea that you could potentially aspirate during surgery?
Exactly. So what we know is that when someone's going to be having surgery and they're sedated, we always worry about the risk of aspiration, because the aspiration pneumonia that they can get can be quite fatal.
That means that food goes into the lungs, you could stop breathing.
Right, the reflux of that food, all your airways are all kind of flaccid when you're in that sedated state, and so we can reflux that food and then it can go into our airway and cause a really severe pneumonia, much harder to treat than the typical classic community-acquired pneumonia. So we worry about that because, remember, these patients are losing a large amount of weight. So they come to us, there's this whole crossover into the aesthetic world, because now they took these medications to look better and their body image, their self-confidence is better, but then they look at their faces and they're looking more gaunt, more hollow, wanting to get things
they don't
like
look the
fillers.
same.
Exactly, more age. So the exact reverse effect on their faces. So they want to have surgery. They come in for surgery, and now we have these other risks that we need to be aware of.
That are associated with the surgery.
With being on the medication at the same time.
I mean, assuming somebody's going in for an elective procedure, not an emergency procedure, is it as simple as just disclosing that you're using this medication?
Yes, it's not just disclosing, but now the anesthesia guidelines are being changed as well as we speak. They're trying to determine what length, what duration of fasting is the best for patients that are continuing to be on these semaglutides.
And we don't have the answer to that yet.
Well, we've definitely increased that now from 6 to 8 hours. We're trying to do 12 hours, sometimes even a whole day. But I'll tell you, we still have patients after a whole day of fasting where the next day that they still have a stomach full of food.
Interesting, because it's just slowing that system down
Absolutely.
that dramatically. Wow. So you say there's also risks with eye health. Can you explain what that is?
That is correct. So a few things that we have noticed. So remember, we're using this for diabetes, and it's been very
Ozempic
effective.
is used for diabetes.
Exactly. Ozempic, Mounjaro, they are FDA approved for that. And so what we discovered is that there is a higher progression of diabetic retinopathy, which are the changes that we see in the retina of diabetic patients that actually reduces their vision. So all diabetic patients are followed for any changes in their retina that could be harmful for their vision. And of course, diabetes control is the mainstay of treatment. You know, it's not just about fixing the damage once it's done, but we've got to prevent it. It's like that freight train that left the station, so we want to slow it down. However, even though this medication is so effective in diabetes management, we noticed a progression or an increased rate of diabetic retinopathy changes in these patients after they started the medication. And I'll be honest, we're still trying to determine if that is something that's going to slow down based on all the studies and all the clinical scenarios we've been seeing. You know, it usually slows itself down in about 12 to 18 months if you're still on that treatment. However, you know, it doesn't warrant us changing anything. Like we haven't been able to determine if it's more beneficial to be off of it or stay on it. You know, so the jury's out on that so far.
Yeah, I mean, what we've been saying since the beginning of my reporting on these drugs is that they just haven't been out long enough to know the long-term side effects.
Absolutely.
So, yeah, but all right, interesting points that you made, Dr. Mirwat Samy. Thank you so much for coming in and joining me this morning.